What we have here is a magnificent dissection of the thorax and abdominal musculature and an injected technique in the abdomen to look at the arteries going to the liver, pancreas and spleen. If you look closely here, you will see a beautiful dissection of each of the segmental nerves that supply the back. This white area is the tough fiber, the thoracolumbar fascia of the back, but coming out of it and supplying these muscles are these individual nerves, one for each vertebral level, and is most magnificently dissected. The average medical student would never manage to keep those nerves. They would get chopped in the dissection process. But even more beautifully here, the actual specimen has been prepared with the anterior abdominal wall opened out so that we can see the six-pack of the rectus abdominis. Here's the six-pack of the rectus abdominis, and each layer of the anterior abdominal wall, which is 3 muscle layers that overlap. You can see how the direction of fibers in this top layer is in that direction, in the next layer is in that direction, and in the bottom layer, which is shining through there, is in fact transverse muscle fibers. And that's how your body wall holds the guts in, by having different directions of fibers overlapping and holding the guts in. This is the six-pack here with the little lines of tendon in between the rectus muscle. And if we now rotate this, we can see that inside, when we've opened up the wall of the abdomen, here's the chest wall at the top. We can see here the liver, the gallbladder, the duodenum, the pancreas, the spleen, and all the arteries that go to these structures have been injected, and you can see those magnificent in red. Here we have the vertebral column. Here's the aorta with the red contrast media. Here is the inferior vena cava. Here is the esophagus, and the sheet that you can see at the bottom is the diaphragm, which is a sheet of fiber and muscle that divides the thorax above, where my fist is, where the lungs normally are, and the abdomen with the liver below.